So I hope you are seeing the PPT.
Yes, can see.
Okay, so for today, we'll just do four drugs. I was planning five, but I'm so tired. So we'll do Rumex, Ruta, Sabadilla, and also Sabal Serrulata. Okay, so starting with Rumex, and Rumex maybe is a medicine you might have prescribed. It is very common for cough with very thick catara. 1 minute, someone is trying to join. Okay. Farah, we are just starting the class only. The first drug is Rumex for today. So, common name is curl dock, yellow dock, curly dock. That's the name. So, because the common name doesn't have any connection with its scientific name or Romex crispus, you can actually expect that one as a MCQ. Belonging to the family Polygonaceae, and actually this contain the leaves will contain oxalic acid, so not toxic in small quantities, but if it is taken in large quantities it can result in acute oxalate toxicosis. Then homeopathic preparation, which is usually the tincture of fresh root. So Rumex, as I told, mostly used for cough conditions where there is intense catara. And also another important one is diarrhea. So a condition where there is cough and also catara or the expectoration is coming out and associated diarrhea. So sometimes the clinical picture of a tuberculosis. That one is what Romex is more matching about. So it is not just a respiratory complaint. An important concomitant of Romex will be the early morning diarrhea. So respiratory complaint associated with early morning diarrhea. That is what Romex is about. So in the Allen's note, which is what we mainly need for the exam purpose, this is indicated for the tubercular diathesis, as I told you, more of a tubercular symptoms. Because we like to always, this is a concomitant condition, that diarrhea they are having, it is a concomitant condition, not that sometimes we learn about Rumex respiratory or some other drugs, it means GIT. So some that means that particular drug may be indicated in respiratory complaint and GIT, but they may be seen independently, the respiratory complaint and the GIT complaint. But in case of Rumex, whenever we are giving this medicine for the respiratory complaint, there should be associated GIT or that diarrhea. And this combination we usually see in a tubercular miasm or tubercular diathesis. They have extremely sensitive skin and mucous membrane also because they have that coryza. So the mucus, it will be very irritated and then the discharge can come out. So such a constitution will be there. So importantly, because it is respiratory complaints, they are extremely sensitive to open air. There will be hoarseness, and aggravation is mostly seen in the evening after exposure to cold, and the voice is very uncertain. Before to the cough, there will be a tickling sensation, and that causes a dry, teasing type of cough. This cough will be dry, very dry, incessant, or that will be very continuous and fatiguing in nature, and that is worse from changing air or room. And this cough, it is aggravated after lying down and also evening, lying on left side. So very similar to phosphorus we can see, because even in case of phosphorus we have all these symptoms that the cough, they also have got the tubercular symptoms. The constitution itself will be, in case of phosphorus, you know, that tall people with very delicate eyelashes, and the tubercular diathesis. And all their complaints also will be aggravating towards evening and thunderstorm. In case of phosphorus, thunderstorm will be a characteristic feature, and left-sidedness. Here also, we see most of the symptoms, but not the thunderstorm aggravation of phosphorus. Here also, there is a fatiguing cough from changing air or room, that is mainly getting exposed to cold air. After lying down and lying on left side, like phosphorus itself, from slightest inhalation of cold air. Covers the head with bedclothes to make the air warmer, little or no expectoration. Then another important symptom is there is a sensation of lump in the throat, and that descends on swallowing but returns immediately. A kind of it's not hysteria per se, but they do have something, a sensation that something is being stuck or a lump is present in the throat region. Then raw sensation in larynx and trachea while coughing, similar to that of causticum. In causticum, also we learned that there is rawness or soreness. Whenever we say about causticum, the rawness and soreness is a always associated symptom. So that rawness, not the soreness of causticum, but that raw sensation will be there in larynx and trachea. And because of that raw sensation, that something is like no, ulcerated, yes, such a pain, that tickling, they have that cough coming out. And along with that cough, there will be involuntary passage of the urine. So this complaint, if we see, and mostly this complaint we can see in case of women above 50 years, mostly they will be saying that when they are coughing, some drops of urine also will go. I don't know about the effect of Romex because I have not tried Romex for this complaint, but I have tried Causticum and Pulsatilla, and it is very effective. No name, sir? Uh, okay, if there is no name, it's very difficult to understand. Huh, huh, huh. Powder? Globules. So you brought the medicine from India, sir? Okay, just ask the medicine. I'll see whether there is. Okay. So yeah, this involuntary passage of urine along with cough. I have tried pulsatilla and also causticum, which I have got result. But because these two things are very commonly available, I have never gone for Romex. Um, and the cough aggravated by cold air, anything that increases the coolness of the air, the volume or the rapidity of the inspired air, everything. The cold is aggravating factor. And as I told, the GIT symptoms are very important. The early morning diarrhea from 5 to 10 a.m. The person will be actually getting up and rushing to the toilet. So this symptom, because of this early morning diarrhea, which we can see in natrum sulf, sorinum, sulfur, uh, and all these medicines, natrum sulf, sorinum, and sulfur, will can also be indicated in case of respiratory complaints. And even in phosphorus, we don't just limit with the early morning diarrhea, but they have almost always diarrhea and constipation. So their diarrhea is the as if the anus is wide open, as if passing through a hydrant. That's the kind the sago is coming out. That's the diarrhea we say in case of phosphorus. So because of these similarities, sometimes the respiratory complaints can be asked to be differentiated. Uh, Between all these drugs, especially natrum sulf, sulfur, sorinum, and phosphorus. And the feature is because the respiratory complaint associated with this early morning diarrhea. The stool will be painless, profuse, and very offensive. Sudden urging that drives the patient out from the bed in the morning. And on the skin, there is itching in various parts, like an urticaria, aggravation by cold. So, cold is a general feature, an amelioration from warmth, and also when undressing, uncovering, or exposing to cold air. Mainly urticaria. Urticaria from cold exposure, we can think of rheumatoid. So, aggravation from cold air, and amelioration from warmth. So, mostly the respiratory complaints where there is hoarseness, there is a tickling sensation, and that producing the cough on the left side, and everything cold is going to aggravate the condition with that sensation of lump in the throat and also urine which passes involuntary with coughing. That makes the rheumatoid complaint. And when we even if only the respiratory complaint is asked, this sentence early morning diarrhea should be mentioned because it is the concomitant over there. Even if you miss the skin symptom, it doesn't matter much, but this early morning diarrhea should be there. In case of Boric's book, it is characterized, Rumex is characterized by many pains, numerous and varied, neither fixed nor constant anywhere. This is the introductory part. And the most important is that incessant tickling in the throat pit, which results in the cough. So sometimes when the patient comes, they will be saying that it initially starts like an itching over there or a tickling sensation. They say something like this, something it is happening over here, and I want to feel like a scratch, and then the cough starts. So mostly the patient says, so that is how the cough is starting over here. The tickling runs down to the bifurcation of the bronchial tubes over to here. Touching the throat pit brings on the cough, worse from the least cold air, and it will be ceasing when you're covering up all body and head with the bedclothes. And even in Clark, I think it has been told that if the person is putting his bedclothes into the mouth, that will ameliorate the complaint. So even the slightest entry of cold air is producing the symptoms, so that the patient will be actually keeping even the bedclothes. That's how it is given. For an amelioration, the person will be even stuffing his mouth with a bedcloth. So that much worse the aggravation from cold exposure the patient is having. The Rumex diminishes the secretions of mucous membrane and at same time exalts the sensibility of the mucous membrane of the larynx and trachea. So other secretions, there may be a dryness, but the mucous membrane of the larynx and trachea, it will be highly sensitive, which means the discharge or the mucosal discharge from these respiratory structures will be increasing. Lymphatics enlarge and secretions are perverted, may be increased or decreased. They cannot eat meat, it causes irritations and pruritus. And when we say this symptom, you can differentiate this symptom with pulsatilla also. Even pulsatilla is having that meat or fatty food aggravation. But then what would be the difference? Can you say me what would be the difference between pulsatilla or how you can make a comparison between pulsatilla, even pulsatilla we can say left-sided somewhat complaints. How we can differentiate the respiratory of Rumex and pulsatilla? Especially the aggravating factors.
We live in open air.
Huh. For them, open air is amelioration, pulsatilla. But here, open air is going to be aggravation. Very simple will be that. Most simply, we could say. Uh, then this I already told the urticaria, exposure to cold air when undressing. Sometimes certain allergic people they have these symptoms, especially when they actually say this when they are removing their dress. At that time, they have got this itching all over the body or urticaria while undressing. Uh, then this all will already be told in case Allen's that it is the cough is actually coming from that tickling sensation. It is also seen in spongia and also Argenta met. There will be mucus discharge copious from nose and trachea. As we told, the mucus discharge from the respiratory tract will be increased. Um, Initially, the expectoration will be thin and watery, but later it will become very stringy in nature. Then emboric says there is soreness also, but more than soreness, as we told in this one, what is that? Allen skin knot. We stick on with the row, and that row sensation is under clavicle. And in Clark, I think, or in Kent, I don't know whether I have kept it over here because exam wise it doesn't matter much. You just write there is a row sensation in the clavicular region or under the clavicle, that will do. But in Clark or Kent, they have given an explanation like the person will feel the cold air is entering from that underneath the clavicle. You see that much cold exposure is going to cause him trouble. So even if that explanation is not written in the exam sheet, doesn't matter. But I just told the patients, or the provers have told like that. They from the clavicle itself, the cold air is entering into his body. Imagine what and all he is saying. The lump sensation in the throat. So here also it is the similar symptom, the respiratory complaints, aggravation from cold, cough, constant tickling, hoarse, croupy, whooping, anything, inhaling cold air, touching the larynx. But one thing that we didn't mention is bending head backward. That also can be an aggravation. Aggravation covering up mouth, early morning diarrhea, Uh, see this one, often accompanied by that typical cough. That's why I'm stressing it because diarrhea plus cough is what Rumex is about. And then lump in esophagus doesn't matter. Itching of skin, we discussed that about. Aggravation cold air, amelioration warmth. Okay, so the yellow dock or the curl dock, which is the common name. It is mostly grown in North America where the provings were made. The common dog, Rumex obtusifolia, is usually used among children for the nettle string. Nettle string is actually what we say the urticaria. Its other name is nettle string. Um, Rumex crispus, which is our medicine, according to Jocelyn, was used by allopath internally and externally for the cure of itch. So for them, it was mainly a skin complaint. Nevertheless, we also have the urticaria complaints, but for us, when we proved it, the most symptoms were towards its respiratory and GIT complaint. Among the constituents and salts of Rumex crispus, there is sulfur and calcarea phos, and that is why we can see similarity of action of sulfur, calcarea, and phosphorus. Calcarea, actually, I forgot to mention in case of because calcarea, both calcarea carb and calcarea phos. More often, calcarea phos is also a condition medicine indicated in tubercular condition, especially the growing age children in the adolescent age. If they are developing this tuberculosis symptoms, calcarea phos is very much indicating. Even calcarea carb also. Keynote is sensitiveness to cold air and characteristic diarrhea. Yeah, this one is I didn't see in other books. Rumex crispus cough causes expulsion of urine that we saw, but it may be as violent that it can even cause the expulsion of the fetus in pregnant women. I don't know whether it had happened. Maybe it shows that how much violent cough it would be, that it has the capacity even to push the fetus outside the, I mean, from a pregnant woman. Then it is some cases which was cured with Romex crispus. So first one, a young lady had shooting from pit of stomach into chest to various directions. And this is what Boric's initial sentence was. There will be pain, varied pain, and sensations in different directions. So that is the first sentence of Boric came from here. Sharp pain in left chest, and we have already seen that they have the left side aggravation. Dull aching in forehead and slight nausea. And one dose of 30th removed all her symptoms and restored her appetite. So here the characteristic symptom what we see is that shooting pain from the chest, I mean from abdomen to chest and then to various direction and the left sidedness. With some, there is no diarrhea, slight nausea, but when one dose of 30 Romex was given, the complaints relieved. A lady, 50 years, had pain in the pit of the stomach for 3 weeks. Along with that, there was aching in left chest, flatulence, eructation, and distension in stomach after meals. And Romex crispus 200, one dose, cured in 2 to 3 hours. Young lady had sensation of fullness and pressure in pit of the stomach extending up towards the throat. So that is like the lump sensation, what we mentioned, the lump sensation in the throat. So fullness and pressure, which is extending towards the throat, carried down on swallowing and rising again to the throat. That exact lump like sensation, how they mentioned, was like this, something that is full and pressure in the stomach. It is coming up, reaching up to the throat, going down, and then again coming up. Even 200 has cured that. A gentleman not used to tea took 1 cup of it, very weak one of the black kind, and followed to it there was pain in the pit of the stomach and aching above it in the chest, especially on each side of lower end of sternum. Rumex crispus was given. Carlton Smith point out that the case of cough cured with Rumex was cough only during the day and not at all at night. And here the comparison comes with ferrum and also manganum aceticum. So all the conditions that we mentioned over here, you can see that there is a respiratory complaint associated with GIT complaint. And all the condition mentioned here doesn't mention about the diarrhea, but everything mentions there is something problem at the pit of the stomach. And along with that, there are chest complaints also. And then we see the medicine have acted upon. So from Kent, Rumex is a neglected remedy. True, it is. We rarely prescribe, maybe because of the other remedies being the phosphorus, one of the most indicated one for aggravation of cold, even calcarea. Uh, so yeah, very less we prescribe Rumex. Have anyone prescribed Rumex? No one. Okay. No, yeah, it is very rarely. I remember one of my madam. She used to prescribe. Her favorite remedy was Rumex. Whenever cough aggravation cold, she used to prescribe Rumex. But that patient also he used to come. I don't know whether he was a hypochondriac. I don't know. Usually medicine will be given for 1 week or 2 weeks, and he will be usually coming very frequently. Not one patient, okay, many patients, many patients. Madam, she was always prescribing in globule 444. So phosphorus is another medicine which can be given for a cough with aggravation in the cold. So maybe because she didn't want to prescribe phosphorus in such frequent doses, she always used to prescribe Rumex 444. That was her usual prescription. So I don't know how much it takes because the patient comes again and again. And to everyone, she was writing Rumex, Rumex, Rumex. So this was proved early actually in smaller potencies. So much mental symptoms didn't come. It was mostly the catarrhal symptoms. And Kent doesn't leave the mental symptoms. The mental symptoms is not so characteristic, even for the exam. But for him, there is a state of sadness, low spirited, aversion to work, irritable mental excitability. That much mental state only we know, but there is nothing characteristic. These symptoms we could find in any person, so it is nothing characteristic. That's why Romek's mind is not given that importance. Um, and it says earlier, like in the domestic or the early school medicine, it was usually used for the cure of eruptions and also boils, like a blood purifier or blood medicine. The catara is very characteristic. It can be given for acute and chronic catarrhal condition. From all the mucous membrane of nose, eyes, chest, trachea, or the whole respiratory tract, there will be copious flow of mucus discharge. So here Kent is mentioning about the catarrhal stage. So he said that he has seen it so copious from the nose that it seemed as one continuous flow. Like that much continuously, it is constantly flowing out. So copious from the trachea and bronchial tubes that the patient continually hogged up by mouthful thin frothy white mucus, so that in a little while as much as half a pint of thin mucus would be there in his spittoon, or the that bottle in which he is spitting on. So it is very much continuously formed that within a little time itself half a pint will be formed. That much continuous flow of coryza will be the from the trachea and bronchial tubes that is being spitting out, and also from the nose. Um in the first stage, like he says that this can be this similar condition we can see in case of influenza, whether there is nasal complaints or the catarrhal condition, the copious mucus discharge. So in the first stage, it will be thin, watery, frothy, etc. As what we say in case of even in pharyngitis or the first stage of inflammation, when the mucus stage is very much thin and watery. But then it goes towards the secondary stage, where the discharge become thick, yellow, white, and tenacious, or sticking to over them. So ropey and stringy that in spite of blowing the nose and coughing, he fails to get it up. So initially it will be that thin watery, but later it can become the thick. So similar to the state of a Cali-bike condition where it is becoming thick, whitey, and tenacious or stringy in nature. And he should sit without any motion, because slightest change of the motion, and if the air is going to get inside, or he cannot breathe deeply, hurriedly, or irregularly, because that also will cause the aggravation of symptoms. And Kant says that it is associated with a burning sensation in the sternal region. Um, but I won't say that burning is that characteristic, because it is mostly the Kent. I mean, only in Kent we see that explanation. And this catarrhal state is accompanied by a morning diarrhea. There is loose stool which will pass involuntary with the cough. So along with the cough, there is an involuntary passage of stool and also involuntary passage of urine. Yeah, I have put it here. There is a pain under the clavicle, or a raw sensation under the clavicle, as if the air came directly under the clavicle, producing that rawness and burning sensation. So even if you forget about the burning sensation, it doesn't matter. That raw sensation under the clavicle, if you could remember, it will be good. Then certain kind of cough are worse at 11 p.m. So here he made a comparison between lachesis and rheumax. Because in case of lachesis also, when young children go to their sleep, they also have a cough around 11 p.m. But in those kids, if they are made to stay awake, they are not going to have aggravation or cough at 11 p.m. Because in case of I mean both the drugs, this is lachesis and rumex, they are having aggravation of cough at 11 p.m. But how to differentiate? There are other features to differentiate, because in case of lachesis, it is extremely hot patient and they would need that air always falling on their face. So that differentiation we can make. But still, another with regard to the timing, that 11 p.m. aggravation, how can differentiate lacusis and rheumaxis? Lacus is actually having aggravation from sleep. The patient sleeps into aggravation. That's what we learn in lacusis. But if the patient is not allowed to sleep, that kids they won't be having cough at 11 p.m. because it is the sleep that make them into coughing. So they go to sleep by 9 or 10, and then naturally the cough will be aggravated around 11 p.m. because they sleep into aggravation. So if we are not allowing them to sleep at 11 p.m., they are not going to cough. But in case of Rumex, the cough will come on at 11 o'clock whether the child is asleep or not. So with regard to that sleep nature and the timing can differentiate lacusis and Rumex. And another medicines is comparing is hoarseness. And this hoarseness we can see in case of phosphorus and also caustica. And in case of this one, Rumex, if there is hoarseness, the person is not able to speak because the vocal cords are covered with tough mucus. We saw, I can itself explain that in the initial stage only, the mucus is coming thin, watery, but after to that, it becomes tough, stringy, and tenacious, so sticking onto that area, the respiratory structures area. So if when it goes to that stage where when the mucus is very tough and covering the vocal cords, when the patients speak, it is more like a hoarse condition. In phosphorus also we have this hoarseness, but more than hoarseness in phosphorus, it is aphonia or there is a loss of voice. And even if he is hawking up a little bit mucus from these vocal cords, phosphorus will have that amelioration from the aphonia. Causticum. Causticum is exactly having hoarseness, and that is due to the paralysis. We like the in case of causticum, when we say there is a raw sore sensation, another one we always say is the paralytic sensation or the paratic sensation, which is seen all throughout causticum. So in causticum, when there is a hoarseness, it is due to the weakness of the vocal cords. So hoarseness is there in all the drugs, Rumex, phosphorus, and causticum, and you saw how they are differentiating the hoarseness alone. But the phosphorus and causticum, why they came into comparison also because of that raw sensation, the causticum, and then the involuntary urination, similar to phosphorus, even in phosphorus, that left-sidedness and the tubercular diathesis, that are the similar symptoms, and then how they differentiated with regard to the hoarseness. It is common for thysical or the tuberculosis cases to have a morning diarrhea, and many of them look like sulfur. So even Rumex and sulfur we discussed earlier, having respiratory complaint with early morning diarrhea. So Rumex is also indicated for the same condition, but it is not as deep as sulfur, but it is also an antisoric. But the use of Rumex is, however, limited to the early stages. But in case if it is a chronic condition, we need to follow it up with another antisoric, and calcarea often follows the condition very well. Rumex is one of the most valuable palliative in advanced thysis, and this one I just liked with these medicines: Rumex, pulsatilla, Seneca, arsenic, and Nux vomica. You can patch up the last years of a tuberculosis patient. So these drugs, the Rumex is antidoted by all these remedies: camphor, belladonna, hyoscyamus. Ascamus is also having cough as soon as the head touches the pillow. Then conium, lacusis, and phosphorus. Lacusis and phosphorus also left-sided complaints, as like that of Rumex. The second drug for today is Ruta graveolens, and I'm very sure this medicine you might have prescribed. So,
Dr.
can
Mira, so
anyone say?
Rumix is chili patient.
Huh?
Dr. Mira, Rumix is chili patient, right?
Extremely, extremely chilly patient. Then what? So, Ruta. Have anyone given Ruta or taken by yourself?
Given for wrist injury.
Wrist injury, yeah, yeah. And how was the thing? I mean, how was the case? How? What was the result?
A result is the first dose worked after 1 week.
Mm-hmm.
Not sure that why suddenly after 1 week, but because injury, I expected that over the days it shows improvement. But anyway, after 1 week, improved. But the second dose repeated didn't seem to have effect. Not sure. Case is in progress. I'm just thinking
Okay,
why the
okay,
second dose. Yeah.
okay. Maybe you had to change the potency. I'm not sure. But yeah, this is one. Lenny, you have any experience with Ruta?
Yes, the reason one was Dr. Pata. He
Mm-hmm.
he came last year and he sprained his back.
Mm-hmm.
And he asked me to send him Ruta 200C to his hotel on that night
Mm-hmm.
itself.
Mm-hmm.
And 3 doses helped him.
Yeah, okay.
The pain, that kind of pain that he cannot move, the bruise pain, the
Mm-hmm.
sprain, yeah,
Yeah,
to the
that's
lambness.
yes, that's the rheumatic complaints, the wrist injury, the sprain, the bruisey nature. So very
Yeah,
much
yeah.
similar, yeah, very much similar to arnica and rustrox. But there is a characteristic difference. That's where we will go into check with Ruta. Many other conditions also can be given for exostosis like Hecla lava, calcarea force. Ruta can be given. Then there can be pain in tendo Achilles or the heel region. Ruta is a good remedy. Then for ganglion, the ganglion we can go for Ruta. So common name is Ru, and because it is Ru, we'll get the clue. It is something related to Ruta, so never MCQ will be asked. Family is Rutaceae. All part of this plant is poisonous and can induce abortion. And also, the sap in sensitive people can cause blistering or dermatitis. And when we hear this, this is much similar with the effect of Restrox also. Even Restrox, if the person is coming into contact with the Restrox, he is also going to have some skin symptoms, and mostly it will be vesicular in nature. So here also some blistering and dermatitis can happen. And then we see in rheumatism also much similar rota and Rustox. Sometimes comparison can be asked like that, rota and Rustox if you have Rustox also, but in this you don't have Rustox. Tincture of whole fresh plant is what the homeopathic preparation. So all these symptoms, oh, this one I forgot. This is a very good remedy for eye complaints, amblyopia, and so many as eye strain when people are doing stitching and all, and or the watch work where there is much strain on the eyes. Ruta is a very good remedy. And anal and rectum prolapse condition, so because of constipation, so that's also another important. There can be pain in chest and sternal region, so a comparison with ranunculus bulbosus or rhododendron may also come over here. There can be dislocation, fracture, and exostosis. Facial paralysis from cold. So, in another word, Bell's palsy. Bell's palsy, mm, this facial nerve paralysis, we can think if it is from cold. Then the ganglion, perichondritis, periostitis, so surrounding to the cartilage or surrounding the bone area. Then also the rheumatism and sciatica. And it also can be given for enuresis or urinary incontinence, varicose vein, and warts. Uh, but the most, I mean, these all are important. It can be asked for any. I mean, Ruta can be asked like Ruta ice. It's rheumatism, even the skin complaint. Anything can be asked from Ruta. And clinically also, we generally tend to remember, even when I was saying, I told about the rheumatism only when I went into, and then suddenly I remembered it is an important remedy for the eye conditions also. So we generally tend to minimize its action or limit its action, or we remember only regarding the rheumatic complaints because Ruta and Rustox, that close similarity. But this is a good remedy for the anal and the rectal prolapse, the facial paralysis, exostosis, and warts. That's also very important. Ruta causations, bone injuries, bruises, fracture, sprain, carrying heavy weight, and also overexertion of eyes. And among this, other symptoms, it will be coming up in later slides, but still I'm saying the most important feature of Ruta will be its affection. Its rheumatic complaints will be closer uh, to the bone region, or in the periosteal region. So in case of Restrox, where it is the muscle, or even in arnica, because they also have that this bruise sensation that is more towards the muscle, and in case of Restrox, it will be the tendon region. But when it comes to Ruta, it should be surrounding the bone area, the periosteal area. That's where for when Vinod gave wrist injury, the bone structures that should be involved in Ruta. If it is rheumatic complaints, but confined in the muscle structures, then Ruta is not going to act. It should be something close to the bone structures also. Ruta will be very much effective. So in Allen's keynote, the physical complaints or physical general says all parts of the body upon which he lies are painful, a sensation of bruit, like in baptisia and pyrogen. He is extremely restless, and because wherever he lies like this, he lies like that, whichever, the body feels pain, so painful. So he will be frequently changing his position while lying down, like the restlessness similar to that of Restox. And similar to arnica, there will be a bluey lame sensation. Oh, it is not coming together. Sensation all over the body as after a fall or blow, worse in limbs and also joints. So that sore, lame, bruise sensation is very characteristic. I told you that eye complaints are very important due to the extreme straining, or as if they had been strained, there will be extreme aching pain in and over eyes with blurred vision. After using eyes at fine work like kneading, stitching, and those fine works or watch works, engraving. Yeah, when people are doing with this engraving, looking intently, and that resulting in complaints of the eye region, orbital not neuralgia, but along with that eye area, if there is a muscle pain, ache, we can think about Rota. There will be amblyopia or asthenopia, where there is a reduced or partial vision because of overexertion of eyes or due to anomalies of refraction. From overuse of eyes in bad light, fine viewing, overreading at night, misty dim vision with complete obscuration at a distance. So eye symptoms are very characteristic. Eyes will be burning, aching, feel strain, hot like balls of fire with spasm of the lower eyelid. Uh, so when you're writing this, I mean for the exam purpose, okay, not for the clinical, the things that is very much required is This one, the second sentence. Uh, because of the usage of eyes at fine work and watchmaking and intently or looking intently, that causing the complaint. Then this sentence also, from overuse of eyes in bad light, fine viewing, overreading, which causes a misreading vision or asthenopia. Even if you forget the word amblyopia, it doesn't matter. Asthenopia, that resulting in eye complaint. Or it can be anomalies of refraction, like a what is that? Our mm, long sightedness and short sightedness. If there is some refractive error also, we can think about Ruta. But in that case, when there is a refractive error, I'm not sure how much this is going to act. But in other conditions, if it is not the refractive error, Ruta could be given. I mean, this one that I have seen giving for the people, when they are doing this fine works. And also I have seen this being given by my professor for the for our own, like during the exam phase. Sometimes we used to stay in the hostel, right? So the main light has to be put off, and sometimes the students may be using the what is that headlamp in their table, the table lamp, which will be having very much dim light. So if they are studying in that dim light during the exam phase, I have seen my own professors giving that remedy. And in that case, Ruta have been working. I mean, I have seen that working, but refractive errors, I'm not sure how much Ruta works. And the another important is when you write the exam, the sensation that balls of fire, the eyes will be feeling like hot, like balls of fire. That is another important term should be there in the paper. Then it can be given for phthisis or the tuberculosis after mechanical injuries to chest, more similar to millefolium. More than clinical symptoms, I would say you can remember this for a MCQ purpose. Then in case of GIT, I told you it is a very good remedy for anal and rectal prolapse. Uh, Ruta. So we were doing
Um,
GIT. I hope you can see the PowerPoint.
yeah, can.
Okay. So we were saying about the rheumatic complaint, not the rheumatic complaints, the eye complaints. Then the respiratory system, I told it is mostly for a MCQ basis. That might be asked for that one. And GIT, as I told, the anal and the rectal prolapse, and mostly due to the constipation. And constipation is appearing because of inactivity or stool getting impacted in the anal or the rectal region following to some mechanical injury. So here also in that complaint also they come in comparison with arnica. And this one, the prolapse of rectum, they're saying this prolapse of rectum can happen during constipation, but other than that, it can happen immediately on attempting a passage. So the person is putting a slightest exertion even to pass the stool. At that time itself, the prolapse can happen. It can happen after confinement, that is, after delivery, and frequent unsuccessful urging. But more than any of this, the most important will be from the slightest stooping. So, the slightest stooping a person is doing, as the slightest one, the rectum is getting prolapsed. So, that one is more important when we mention about the prolapse of rectum. The slightest stooping, it will result. So, it will be usually a full protruded rectal condition. I mean, the rectal prolapse that it is getting aggravated from the slightest stooping. Then in the urinary complaint, here also there is incontinence, the pressure on the bladder as if it is constantly full. So even when the bladder is not full, the patient will be always having a sensation that it is full because there is a constant pressure on the bladder. So even when the patient has passed the urine completely or the bladder is empty, still he will have that full sensation. Uh, he could hardly retain urine on account of urging, and if it is not attended, it was difficult afterwards to void it. So that constant pressure sensation, like cystitis, that feeling of that fullness of bladder, which is not ameliorated even after passing urine, we can see over here. And then the next symptom, the scanty green urine, that gives the clue what this is saying about. When we say the urine, if it is greenish in discharge, it obviously means they are going towards the gonorrhea condition, the psychotic manifestations. So mostly, now this is another similarity between Ruta and Restrox. Even in Restrox, it is a antipsychotic remedy. So here also in Ruta also there is a gonorrheal element, and that is why they are showing that initial cystitis or the bladder related complaints, incontinence, etc. So we get that similarity over here also. In the, I mean, that similarity between Restrox and Ruta with relation to the gonorrheal complaints. In Ruta, how it is manifested as an acute cystitis, that pressure sensation, which is not ameliorated even after passing the urine, that we can see over here. Then in the case of rheumatic complaints, so rheumatic complaints, though I mentioned here separately, not I, in Allen's keynote itself, it has been mentioned here, bones separately and back and extremities separately. But for the exam purpose, mostly it will be as like rheumatic complaints. So then both of it should be mentioned together. So as I told you, this is very good because it is the periosteolysis conditions. So that rheumatic pain or the rheumatic complaints should be in areas where or in or around that bone area. That is the characteristic feature. So there is scrophulous exostosis or the extra growth of the bones, bruit or mechanical injury of bones and periostea. There can be sprains, periostitis, erysipelas, like our Restrox, fractures and especially dislocations, similar to symphytum also. But symphytum is exclusively that bone area when the fracture has occurred. But here, yes, fractures, even in Ruta and symphytum, both can be given for the fracture and the dislocations. But this one will be more related with that characteristic sprain and that brewy nature. And symphytum, they also have that soreness of arnica, but mostly it is indicated when there is no union possible. So to make that callus development, symphytum is usually given for that. But I have seen though certain situations when I feel like why symphytum is given because I mean why ruta is given when even symphytum could be given. And when I ask this, because if it is the bone and they doubt about the fracture, small fracture, hairline fracture, especially in the small joints. And I have seen my teachers prescribing Ruta instead of Symphytum. So when I asked why Symphytum was not given, but Ruta, the thing was when they clinically give the medicine Symphytum, the action of symphytum, though we study in theoretically, it is helping in the union or the healing of the fracture, or union of fracture. Though we study it clinically, but when I mean theoretically, when given clinically, the action of symphytum is very much limited. But my teachers have seen more action of this union of these small fractures with Ruta and Calcarea for 6x. They have got more action. So that is why in my practical, I have seen mostly Ruta being given for this non-union of fracture, and then to promote it, given that. Then lameness after sprain sensation, especially of wrist and ankle. Um, and if it is chronic sprain, bovista and strontium. Backache relieved by lying on the back. So maybe Lenny's Pata sir had this symptom also along with that sprain that there is a relief from lying on the back. He might have taken Ruta. And in case of skin, there is warts. Here it is not mentioned about the ganglions. Maybe it is coming up in other textbooks. In Allen's skin, or they mention only the most important symptoms. But this is a good remedy for ganglions also. And anyway, in the skin, it will be for the warts, and it is seen on the palms of the hand, like natramute, natranca, ruta. And if it is on the back of the hands, it will be dull camera. More often, yeah, clinically, yes, we can give because exact location has been given, and when exact location is given, that medicine acts better. But other than that, this is also important. This point can also be important for MCQ purpose. So here, the affections of fibrous tissue, tendon, joints, and periosteum. Uh, Mind, in case of Ruta, is not that important, but still there is a panic of fear of death during heat or entering a hot room. There is restlessness similar to that of Rustox, and patient changes position frequently. There is a sluggish, slow mind, aversion to company except when he is in panic. So at that time, when he is panic, he needs someone to feel that secure. Then there is a fear of evil, anxious, irritable, rigid person. But I say you, this is not important, like in a clinical way when we are going to give Ruta for the rheumatic complaints or even this um, the eye complaint or the prolapse. This is not a characteristic or something that is pointing out symptoms of that particular. Then, yeah, injuries to the fibrous tissue, all the joint, bones, tendons, and here you can see bursitis or the ganglion formation. Um, then aching, burning pain in the eyes, like balls of fire. So I told this comparison, like balls of fire, that is important from fine work, reading, and sewing. Paralysis of the bladder after over distension or forcible retention. Back pain, aggravation, inspiration, and amelioration lying down. Arthritic pains like that of Rustox, aggravation from cold, damp weather, and prolapse of rectum on the slightest stooping and before or during stool also. So this will be the this and for an exam purpose, this one and the Allen skin not will cover the main symptoms. You don't have to go for what has Trent written or what has Clark written. That is just to give you more associated symptoms so that you can remember the main symptoms. Sometimes if we have to by heart Allen skin knot, we can by heart it. Repeated study, we can by heart it. But after we write for the exam, then even I can't remember much. I may remember or two or three, or maximum two or three remedies for comparison. Sometimes I even forget that. So the thing with that is it is Allen's keynote or this one we can easily memorize, but that will be only in our short-term memory. But if we read the other books, Clark, because they will be giving extra points, how this one sentence they got improving. So when we have these associated symptoms, associated means not concomitant, how this symptom developed, its pathogenesis, the symptom pathogenesis, it will be more going towards in a long-term memory. So that is why I keep the symptoms from Clark and also Kent. But for the exam purpose, the Allens will do, and also yeah, Boric. So here they have specifically other symptoms. What all the periosteum, cartilage, eyes, and uterus. We have seen that, and mostly the flexor tendons are affected. Even in case of Rustox, it was the flexor tendons that is affected. The deposit formation, that is that ganglion in the tendon, especially the wrist joint, we can see. Then overstrain of ocular muscles, sprains as if bruised. Yeah, this is an important symptom. Okay, this is in boric. It is shown carcinoma affecting the lower bowel. So the large intestine that after two sigmoid colon, the structures. If there is a carcinoma, rectum, not rectum, sorry, ruta is a specific actually. If there is a carcinoma, then difficult feces that we have told prolapse ani. Protrusion of rectum when stooping. Here I mentioned only, I mean, I put the symptoms, but coloration I did only for those symptoms which was not mentioned earlier. Uh, Legs give out on rising from a chair, hips and thighs so weak. But if in for exam purpose, not important. But yeah, clinically, if some patients are saying, you can think about then the ganglion formation, aching pain in the tender Achilles region. Then Clark, it's talked about from where it is being covering the nativity, and then Clark, the initial part will be regarding what were the symptoms available in the old school, because all our medicines were in old school medicine. How did they use that? So any medicine, it was indicated for some condition. To know how it will be homeopathically, they took that medicine and then tried to prove it. So in Clark will it will be always they are saying what in old school it was used. So in old school medicine, this Ruta, it was used for epilepsy, hysteria, hydrophobia, weakness of sight, ozena, epistaxis, gum boil, flatulent colic, inertia of the bowels. But when we prove it, we can see most of the symptoms coming from this one ocular weakness. We told that. Then inertia of the bowels. That is what we mostly got the symptoms. And if it is Ruta was locally applied, it is a powerful irritant and dangerous to handle even with gloves. Ruta is especially suited to robust person or very strong, well-built person, sanguineous in nature, and corresponds to hemorrhages from nose, gums, and rectum. But more than that, this one will be good to remember. It certainly acts strongly on deposits of serous material or hard type of cancer in both breast and in vagina, and sometimes lessen the size of this. Was told by Cooper. For exam purpose, also I won't. I mean, it doesn't matter even if you couldn't remember, but remember what is being given in Boric, and that carcinoma of the lower bowel. But here Cooper have mentioned, which is being given in the clog, that this is good for heart tumor, which is present in the breast and also in vagina. So in that manner, we can compare with conium, and which is the other one, heart tumor, calcarea floor, and then phytolacca. But that was mostly old school. But when Hahnemann had proved this medicine, what he actually got was mostly the action with the injuries or that or brewy nature. So when he proved homeopathically, we got the sprain sensation or the sprain pain of Rustox, brewy pain like that of arnica. But the main feature is Ruta has this bruit pain or this sprain sensation, but particularly manifested in bones. So that periosteotitis, perichondritis, that is more important. If that nearer to the bone, that structure, it's not here. It is all already told were the structures or near to the tibia. That tibia, the affections will be more. So Rota is one of the chief remedies for injured bones, especially the bruise sensation. This power of Rota does not appear to have been known before the provings were made. So this injury action of Rota, it was not known to old school medicine. But this eye straining and that impaired sight, that was also an old use of the remedy. Then it is the same thing. feel of heat and burning in the eyes, pain in them when he reads, especially in the evening by the candlelight or very dim light. Then another effect is the prolapse of rectum, aggravation from stooping, especially by crouching together. And Seven Rushmore, he had cured with one dose of Ruta 900, Finke potency, a prolapse preceding a very difficult stool. Can be constipation also, especially from inactivity of rectum or impaction of feces. A prolonged use of Ruta 3x has cured ganglion in front of left wrist. It's a good remedy, huh? Ganglion. That I have seen. Reducing the size, I have not seen that it is getting completely cured, but the size has reduced. That I have seen. So here, Kent is comparing actually Restrox and Ruta. So he says whenever we get the symptoms of sprain, we usually think about Restrox or even Argendum nitricum. I'm not sure why Argendum nitricum came over here, but because Ruta action is not well known, and then he is going towards the comparison of Restrox and Ruta. And the common symptoms between Restrox and Ruta will be that aggravation in cold, damp weather, then because of the straining, overstraining or overexertion, and mostly affecting the tendons, aponeurosis, the fibrous tissue, and tendons also that will be the flexor tendons. So these will be the similar symptoms of Restrox and Ruta. But what is making Ruta special is what we told earlier itself, what we saw in Clark, mostly the periosteal trouble. So it should be more near to the bone structures. Periosteal trouble where the flesh is thin over the bone, that is in the tibial region. Then bruit go away slowly and leave a hardened spot. Thickening of periosteum, a knotty nodular condition of the ganglion, which remains sore and slow repair. So all those sprain condition, what we see in Restrox, arnica, or whatever, coming in Ruta, but then in case of Ruta, it should be near to the bone. Periosteum should be there. Then only we get that specificity where Ruta has to be prescribed. Or that is where we differentiate Restrox and Ruta. Uh, so a lump in certain type of people, so certain not certain type people who are involved in certain type of occupation, like farmers, woodmen, mechanic, holding hammer or iron instrument for a very long time, that can result in hard nodules forming on their palm. As from using a crowbar, like because of their occupation, a hardened mass of tissue can be formed. And in those conditions, the lump that is formed, if you are going to give Ruta, it will be active. So he says because of the presence of that growth, the ganglion or this deposit, that will result in the contraction of flexors and that will be permanently flexed. So the foot become flexed so that the sole becomes increasingly concave and the toes are drawn from overstraining. And similar changes we can see in hands also because of that small tumor or hardened periostatic deposits being formed. And if that is formed and there is a flexion that is formed because of this hardened mass, if we are going to give Ruta, it will be producing a good result. So it is antidoted. Ruta is antidoted by camphor, antidote to Merck, and complementary to calcarea force in joint affections. And this complementary reaction was utilized by my teachers when they were prescribing Ruta in potency and calcarea force as a biochem. So after arnica in joint affections, after symphytum in bone injuries, but as I told you, I have seen directly given Ruta. Then all the other remedies, Calcarea causticum, Lycopodium, etc. The third one is Sabadilla, very rarely prescribed medicine. Have anyone of you given Sabadilla?
Sabadilla. No.
No,
Yeah,
never.
mostly throat complaints, and they have some illusionary disease, imaginary disease. So many imaginary diseases they have, like so many, like Tuja. So like Tuja, they have so many sensations, or thoughts, fixed thoughts. That is there in Sabadilla, and mostly the complaints are concentrated in the throat region and also for hay fever. Hay fever also we can think of Sabadilla. So common name it is Sabadilla seeds, Sabadillae. So you'll understand that because of its similarity with the original name, never asked just a MCQ. Belonging to the family Melanthaceae or the Liliaceae. Then its toxic alkaloids can cause nerve function paralysis and death in insects. Sabadilla causes severe irritation to skin and mucous membrane, and this mucous membrane irritation is what make it qualified to give for hay fever condition. So it can produce powerful sneeze inducing effect when we are inhaling it. um, Ingestion, if we are going to ingest it, it can result in headache, nausea, vomiting, diarrhea, reduced circulation, can cause convulsions, cardiac paralysis, etc. Homeopathically, we are using tincture of the seeds. So as I told, mostly diphtheria, and nowadays diphtheria, it is very difficult to get. So, but the throat related complaints, so throat, acute or chronic, we can think about it. But still, it is very useful only in acute conditions. For the chronic conditions, we have to go for a deeper remedy. Hey, asthma, that acute allergy, whenever you person who is having allergy, they go into the area where there is some dust, not dust, mostly pollen grains, the spring season, and then immediately the allergic symptoms coming out, the coryza coming out, like what we learned in allium cepa. uh, this one Sabadilla is another remedy. Then also given for head lice. Though I saw this, I'm not sure how head lice Sabadilla is given, maybe as a external, but because I have not seen. Then all the imaginary diseases for the stricture of esophagus, because I told that it is the throat region they have that problem. And an important one, the tapeworm affections. So the causations is mainly from mainly thinking, because I told you that now when we go to the symptoms, we'll see that they have got lots of thoughts, so many illusions. So the complaints, the ailments from also from this mental exertion, fright, and thinking. Another one is worm complaint. So in following the Allen's keynote, the constitution, the person will be having light hair, fair complexion with a weak, relaxed muscular system. Not so characteristic, but yeah, we get to know that it is more indicated in fair complexion person who are having a weak, relaxed circulation or a muscular system. Such a not a robust constitution, not a well-built or a dark or a brunette, but in a blonde type of persons with a relaxed musculature. And here comes all their illusions that he is sick, parts shrunken. This is also important, okay, parts shrunken. I don't know why did I forget to darken, I mean, color it. But the affected part feels that whatever part that is affected, especially in the, even in the throat region, that it has shrunk its size, or it has reduced its size. So the that he is sick, his parts are shrunken, that she is pregnant when she is merely distended from flatus. So that pseudocyesis, this is actually pseudocyesis where the lady is feeling that she is pregnant, and that is also pseudocyesis is more because the lady intensely wants to be pregnant and she is not able to conceive, and then her mind start thinking that she is pregnant. So that is pseudocyesis condition. We can see that in case of Crocus sativus and also Thuja. And she has some horrible throat disease that will be fatal. Then there is delirium during intermittent conditions, similar to that of podophyllum. More this sentence you study for a MCQ, because Sabadilla we remember for hay fever, we remember for the mild symptoms, but fever or delirium related we tend to forget. So mostly for MCQ purpose. Then worm affections like Sina, Silesia, and Spigelia. Then there can be headache from worms and also too close application of attention. Not much important. Then now the symptom throat comes. So if for exam Sabadilla, if throat is being asked, after mentioning throat, even if it is 5 mark, after mentioning throat, just one sentence at least about the illusions. A few of that, the part is being shrunken, and they have some fatal throat disease, because we are mentioning about the throat. So their sensation or the illusion, not sensation, the illusion that they are having a very serious throat disease that need to be mentioned for you to score more marks. So in throat there can be diphtheria, tonsillitis, or sore throat, and they can swallow warm food more easily. Stitching pain, and most of the symptom it goes from left to right. And then we see a comparison, the left to right, even lachesis and lac caninum have got. But from this modality, can someone differentiate Sabadilla and lachesis? This modality, the warm food. Anyone remember what about lachesis? Okay, always remember.
They're aggravated by swallowing liquids, right?
Which
Or
one?
like
Yes, yes. So that is one aggravated by liquid, and also here we can connect in another way, Farah. This one, Sabadilla, they can swallow warm food. Even lachesis also, they can swallow very easily the solid material. But liquid is aggravation. But in case of lachesis, because they are hot patient, they can't tolerate anything warm. But Sabadilla, they need that warm food. So even though they have that left to right problem for lachesis lacuninum, the way more lachesis is being differentiated is both having amelioration from having the solid food. But in lachesis, because it is a hot patient, warm food are aggravating. But in Sabadilla, this warm food and drinks, even drinks also. In Allen's it is not mentioned, but in Boric it is mentioned. Warm things will be giving an amelioration. So that is how it is differentiated. And in lachesis, one way to remember, because it's Farah who answered, one way to remember in throat complaint, just imagine always this picture, the throat complaint, a snake swallowing a human being. Just keep it that in your imagination. So always it is a snake, the bigger type, the python, no? I don't know its English name. The bigger one, they can actually, human being they swallow. I'm not sure, but anyway, animals they can swallow small goats and all they can swallow. They should be able to swallow human being also because their lower jaw can be extended at any. I don't know whether they actually have swallowed human being, maybe, but they can. So imagine always a snake that has taken a human being or an animal inside its throat. So that is the lachesis patient. They can easily swallow during this diphtheria or tonsillitis a solid thing, but if it is liquid, even snakes, there is a belief like the Hindu religion people they follow. I don't know what is the truth in that. I belong to Hindu religion, but still, particular day, It comes monthly also, but then it also comes annually. Annually is given more importance. They keep, I mean, Hindus, they worship snakes also. So there are special temples for the prayer for these snakes. So not all the temples, but in some temples which is dedicated for snake and this rituals, it will be kept in um, like a mini forest, not a exact jungle, but a particular some land area will be just left as like a mini forest within the maybe a traditional or ancestral family is there, and then over they will be having acres of land, and in some area they won't go there. I mean, they will just go to light the lamp, but they won't cut down any trees. Then trees, plants, everything grows so that it become a mini habitat, so that it becomes its own area, a biosphere, I can say, in which organisms or different living beings, plants, animals, birds, etc., can be seen. And because they don't go into or cut this biosphere, there will be uh, mm, snakes also present over there. So monthly, that particular day, the Hindu religion, the people, they have the tendency, not the tendency, they have the practice of keeping milk in a small bowl, and they believe that and they leave it over there and we go, because we don't think that the snake is going to come and drink in front of us, but we keep it and we go from there, and then we come by evening, and then we can see that the bowl is almost half finished or sometimes completely finished, and people used to believe it is actually the snake which came and drank the milk. Now, that is the religious belief. But when we go, snakes actually don't have that capacity. Physiologically itself, they don't have that capacity to drink milk and all like that. I'm not sure how do they drink water. Maybe from the water, like if there is some river, I don't know how do they drink. But anyway, from the bowl to suck like that, this is impossible for a snake. But still, that is a part of the religion, a part of their culture. They continue to do. So you can remember the situation when you're asked for lachesis also. Apply it towards the lachesis. So imagine whenever the throat complaints for the lachesis come, imagine the snake that is having some man on the throat region, and because it is trying to swallow it, it doesn't have the capacity to drink water. So apply that aggravation from drinking, and amelioration from having, or they can easily swallow solid food. That if you keep that in your imagination, it will be always, it will be coming in your memory easily. There won't be any confusion. So another symptom of the throat region of Sabadilla is there is a sensation of skin hanging loosely in throat, and they should always swallow it. Such a sensation is there. In case of Natramure and Silesia, we have a sensation that is a hair. Hair is lying on the tongue region. That is in case of Silesia and Natramure. But in Sabadilla, as if some skin is hanging from the throat region, because they have got a lot of illusions and they continuously swallow it. There is dryness of fauces and the throat region. In respiratory, as I told, that there is hay fever symptoms. So there is sneezing in spasms, followed by lacrimation, copious watery coryza, and face will be hot and eyelids red and burning. That acute inflammatory condition when the person is just exposed to that the spring season, or going near to that particular plant and getting exposed to that dust or the pollen, the acute reaction that is happening, the coryza, the lacrimation, the eye becoming red, burning pain, the same we can see over here. And in nervous complaints, there is epilepsy that is possible, and mostly it is because of the worm complaint, a reflex of worm complaints. So the nervous disease with twitching, convulsions, catalepsy, and that is due to worms. Skin, it will be dry skin, And in keynote, it is saying only dry skin, but in Clark, they have given more clarification with regard to the dryness. Um, Even like ending crude, uh, it can be given for thick skin, callousness. We can give this remedy. So this is a remedy for hay fever, hay asthma with sneezing. Mind is important. So many delusions or fixed ideas he has. The parts of the body are deformed. The body is shrunken, especially the throat region. All the affected parts are all shrunken. Delusion that she is pregnant. Hypochondriac, delusion that he has incurable disease, fear of death, fear of evil, and also water. Physical, the same things, the paroxysmal sneezing with epistaxis and excessive lacrimation. Epistaxis doesn't matter much. It is that excessive lacrimation and that coryza with that reddish burning sensation you have to remember. And it is ameliorated in warm room because the person is chilly and wants everything warm. Warm bed, warm drinks, warm room. Headache from mental exertion or putting too eager and attention to anything. Then there is a sensation of lump, foreign body in the throat, or something that is hanging there like a bundle of hair with a constant desire to swallow it. Sore throat in the left side extending to right. And there is worms. From the worms, it can also be convulsions or vomiting of worms. So mainly Sabadilla will be their mind, their illusion complaints for the hay fever, and another will be the worm complaints, and worm complaints leading to nervous symptoms. Aggravation, everything cold, and amelioration from warm drinks, warm bed, warm weather. Desire and aversion, it's not much important, but you can go through it. They desire raw onion, buttermilk, lemon, warm food and drinks, and aversion to onion. Yeah. Sour fruit, acids, meat, but I will never say you to remember this desire and aversion. So in Boric, what they have given is action on mucous membrane, the lacrimal glands, indicating action towards the hay fever. Chilliness or sensitivity to cold, that is why everything warm is ameliorating. The good remedy for the worm complaints, ascarites, and reflex symptoms, mostly nervous complaints, the convulsions, but in women, it can also result in nymphomania. Children diarrhea with constant cutting pain, and children diarrhea because of that uh, worm complaints. Nose, spasmodic sneezing, running nose, copious watery nasal discharge. Throat, the sore throat beginning on the left side can be given also for the chronic type. Warm food and drink relief, sensation of the skin loosely hanging, and lump sensation in the throat. They have a canine appetite for sweets and farinaceous food. Sweets connected to the like Sina connected to the worm complaint, and then the desire for the hot things or the warm food and drinks that which we told. Then we in the Alan's keynote we saw that they have delirium during intermittent, but we don't study anything about the fever. But this one in the fever, there is a chill sensation or the chill is predominating. Like in Anika, there is heat in the head and face or upper part of the body, but extremities, hand and feet is icy cold. Another characteristic symptom is thirstlessness. So in that manner, because there is thirstlessness and there is chilliness, another medicine which can be coming over here for comparison might be pulsatilla. And in the skin, as I told in keynote, it is only given dry like parchment or very dry skin. But over here we get the horny, deformed, thickened nails, like what we learn in Silesia and Improved. Can give that. Then there is a crawling sensation, itching in anus, etc., mostly related to the worm complaint. So, as per in Clark, Asagria, the family or the genus into which this Sabadilla it belongs to, there's only one species, Asagria officinalis, and that furnishes the Sabadilla seeds from which veratrin was prepared. And this veratrin or these seeds were formerly used to destroy that vermin. And that is why even in our homeopathic proving, we got the action for the worms. Sabadilla first appears in the homeopathic literature as one of Staff's edition, and Hahnemann was one of the prover for Sabadilla. This is mentioned even in the year 1572, and they say in the old school, even at that time in 1572, it was used for destroying lice. So that may be the reason the head lice came over here, but homeopathically, I don't think that symptom has been got. Maybe they are putting it in some patent. I have seen Sabadilla in patent. This might be the reason. And also worms in putrid ulcers and in the intestines. So this the veratrin, and when I say veratrin, even the Veratrum malp, it belonged to the family Melanthaceae. So initially, even at that time, this medicine Sabadilla was used for these purposes, for killing the lice, worms, etc. Symptoms are periodical and paroxysmal. That is why it is indicated in intermittent condition. And periodicity is almost similar to citron. That is another characteristic remedy for periodicity. Then what is that? The coryza, aggravation open air, the catarrhal symptoms. Yeah. This one, as I told, because it is mostly indicated in acute asthmatic affections or acute, not asthma, the hay fever, but it won't help in removing that tendency or a longer cure or not to cure the diathesis. So Sabadilla is not acting that deeply. It is only in superficial action. So the hay fever with that acute symptoms, that is where Sabadilla acts more. The sore throat with sensation of foreign body and a constant necessity to swallow. Yeah. Kent gave Sabadilla to a pet dog which had great irritation of anus, and soon afterwards he passed a very large number of worms. Sometimes I have seen the condition in which Sina we give for worm complaint till there is no change. We can go for Sabadilla. I mean, if the symptoms are mostly the tincture type. The chilly patient, they want everything wrapped up, hot drinks and hot food. Yeah, here they are saying the reverse of lachesis, what I mentioned you now. They require hot drinks and food, but lachesis doesn't want even liquid is totally intolerable for lachesis, aggravation for them. They need the solid food, but the cold one. For Sabadilla, it is the warm things that he requires. For the catarrhal condition, Ken says it will be initially the thin mucus, then later the thick mucus, and coryza is ameliorated from inhaling hot air. So usually we can see the patients sitting near an fireplace during coryza. Even thinking of the order of flowers make him sneeze and increases the flow from the nose. The specific idiosyncrasy, can think about it. Then these are the comparisons. Mostly this one, imaginary diseases, because Tuja is also having so many fixed thoughts. And sensation of something alive in abdomen, osteodocysis, and it is moving about, crocus and Tuja. And last one for today is Sabal Serrulata. So palmetto, a very good chance for MCQ, belonging to the family Palmaceae. It is Sabal Serrulata, mostly it is given for bladder condition, prostatic condition, and also to increase the size of mammary gland. Yeah, these are the conditions in which Sabal Serrulata is given. So it's usually given because the diuretic, because it has action on the bladder, and also as a sedative. Can be given for the respiratory mucous membrane, which is accompanied by chronic catarrh. It has been claimed that Sabal Serrulata is capable of increasing the nutrition of the testicles and also mammae when there is a functional atony of these organs. Then what? Homeopathic preparation, we take the tincture from the fresh ripe berries and seeds. Yeah, also for bladder and urethra, I told now all the urethral bladder complaints, prostatic complaints, Sabal Serrulata is indicated for that. So breast, when it is inflamed or it's atrophy, we can give enuresis, prostatic complaints, lactation problem, impotence, any affections of uterus, its misplacement, or even tumors. So Sabal Serrulata is not there in Allen's keynote. So we have to study it from Boric. So it is more homeopathic to the genitourinary organs. There is a general and also sexual debility. Uh, General debility, when Sabal Serrulata can be given as a tonic for the general growth, development, nutrition, and also tissue building. And their stomach, ovarian, and head symptoms are characteristic. Of unquestioned value in prostatic complaints. There is a tendency for the doctors, especially very senior doctors, to give whenever the moment they hear that the man is about 60, 65 and he's having prostatic complaints, uh, that they do have a tendency to give Sabal Serrulata tincture for continuously, take it off like that. So epididymitis and also urinary complaints acts on the membranoprostatic portion of the urethra. It's also valuable for undeveloped mammary glands. There will be fear to go to sleep, languor, apathy, and difference, not much characteristic. And there is a desire for milk, similar to Rustrox and Epis. There is a desire for milk. So the urinary complaints, because it is the urinary complaints, male complaints that is important. There is a constant desire to pass water or urine at night. It can be enuresis due to paralysis of the sphincter vesicae, chronic gonorrhea, cystitis with prostatic hypertrophy. All the clinical symptoms related to the prostatic complaints, cystitis, enuresis, everything is there. And in males, there is prostatic enlargement with discharge of prostatic fluid. There will be wasting of testis, and that is why it is told that it could be given for the growth of the testicle. But mostly, I have seen, or what they have seen is given for the atrophy of the breast. Then there is loss of sexual power. Coitus is painful. For the sexual neurotics, organs feel very cold. In female, ovaries, we saw that it is affected. So ovaries will be tender and enlarged. Breast will be shrunken or shrivel. Young female neurotics who are having either suppressed sexual desire or perverted sexual desire. So if females who are having some suppressed or perverted sexual inclination with shrunken breast and ovaries being affected, we can think about Sabal Serrulata. So for the comparison, we can think about phosphoric acid because it is also a very good remedy for sexual debility. Stigmata medis, another one for as a tincture it is given for prostatic complaints, impotence, and also epis. Epis more towards the ovarian ophritis complaints. That's how the comparison comes. Prostatic, they have given ferrum pictricum, thuja, and picric acid also. Another one given in tincture is Populus tremulus. It's a rare remedy. So dose is usually mother tincture 10 to 30 drops, and third potency is often better. And in Clark, uh, it is initially some symptoms. Um, in his little book entitled Soap Palmetto, Hale has put together most of our available knowledge. And he says that this plant, the fruit which is called as the berry, when it is eaten, at first it will be very sweet, but in few seconds it is followed by a acrid pungent sensation in the fauces, nasal mucous membrane, and the larynx. There is a sensation as if those part has been coated with oil. So it is just the poisonous symptoms, not poisonous, but the physiological symptoms. If we are going to eat the direct berry, what is going to happen? And then he saw, this is how he got to know that Sabal Serrulata has got a action on the nutrition. While on hunting trip through the wilds of Florida, Hale observed the great fattening properties of the berries on animals. During summer, food is scanty and the wild animals become very thin. But as soon as the palmetto fruit ripens, they improve rapidly, and in few weeks they put on so much fat that they become an easy prey to the hunter. So this was noticed by Hale when he was traveling through the forest of Florida, and that is how he understood that this berry is having some nutritive or growth and development related action. Now, so in Clark, so many cases have been given where Sabal Serrulata proved. I just put a few. We go through that because the symptoms what you have to study for the exams is mostly that is being given in boric. That will do. This is from Clark. I took only the cases in which Sabal Serrulata was given. So the thing that it can be given for the atrophy of for the growth of mammary gland that was actually got from a prover, Miss Annie Rosak. So she was the prover, 23-year-old. Before proving, her bust measure was 32 inches, and after the proving, her bust measure changed to 33 and a half. So this prover also had many symptoms in the head and ovaries, and that is how from the prover they understood the characteristic effect of Sabal Serrulata on mammary glands. Another proving is of Freda M. Langton. For her, all the mind, bladder, ovaries, and uterus, all the structures were Sabal Serrulata acts was strongly affected. One symptom she developed was irritability and depression. And sympathy, which did not merely aggravate as with natrum mur, but it made her angry. So Langton relates that she was unable to find antidote and suffered for 3 months after the proving before she found one. And then she actually initially used Silesia, and she was okay with that. But then when the symptoms again came up, like bladder and the ovarian trouble was gone, but when the symptoms was only partially relieved with Silesia, Sabal Serrulata was given, and she was completely and permanently cured with Sabal Serrulata. And this another proving on two men's unmarried prover, and they had action in the genitourinary sphere, including increasing their sexual power. And another condition illustrating the prostatic action. The urinary complaints also, the great tenesmus in neck of bladder, sensation of coldness extending to external genitals. It has been given. Sabal Serrulata, 5 drops night, morning. So So all the symptoms similar, the genitals and the urinogenital area and the prostatic complaint. Sabal Serrulata was given and it was relieved. Steady improvement, and in 8 weeks all symptoms had gone. The person 45 years with increased frequency of micturition, despondent, distressed, appetite capricious, little sexual desire, coitus followed by digging pain in the and in back and also tenuousness. Genitals were cold, dull aching pain in the prostate. And Sabal Serrulata gradually relieved and cured in 3 weeks. This was a very different case, different from what we discussed earlier. So this is iritis, when there is inflammation of iris. Along with that, prostate complaints are the Sabal Serrulata is almost as specific. So Hale says, E.S. Evans of Columbus, Ohio, considers Sabal Serrulata almost as specific in iritis when the prostate gland is involved. He had cured cases with 3x, which could not be relieved in any other way. So iritis plus prostatite complaint. Earlier, when we mentioned even in Boric, this complaint was not mentioned properly, but in Clark it was mentioned. This sentence itself, iritis with prostatic complaints. This is a noteworthy observation, and why so means the connection between gonorrhea and syphilis in the eye is very well known. And I have known several cases of ophthalmia developed in patients who were taking another prostatic remedy, Solidago, for their trouble. So that is how the connection was made. Otherwise, when we hear iritis and prostatic complaint, we might think, oh, what is the connection? But it is connected with gonorrhea and syphilis, because we know gonorrhea and syphilis, definitely they are going to produce ophthalmia. So if there is a iritis along with prostatic complaint, which shows some connection with gonorrhea or the syphilis, Sabal Serrulata is a very good remedy. And another one, person with impotence, difficulty in micturition, testicles shrunk, penis shrunk, Sabal tincture in GT drops, 15 drops, 4 times a day was prescribed. At the end of the first week, he complained of drawing pains in spermatic cord. There was free flow of urine. He slept better, and also he felt better. At the end of the second week, the testes were gradually increasing in size, and erections were established. And in 2 weeks more, the cure was complete. The testes even larger and firmer. The drug relations, it is antidoted by silicea and also pulsatilla. For the ovarian complaint, comparison with Epis and Mercurius. Pain in right ovary and thigh Epis. Well, I think breast complaint, corneum, calcarea, even phytolacca. The prostate and eye complaint, another one, though we mentioned earlier, Solidago will come over there. And aggravation from coition, calicarb also. Other things doesn't matter. Okay. So we'll stop over here. You have taken the this one, right? Yeah, I got it. Okay, so thank you for today. We'll see. Oh, next Monday we don't have class. 1 minute, let I off the recording.